Joining me right now is Oak HCFT Venture Partner and Chairman of Medical Ethics and Health Policy at the University of Pennsylvania, Dr. Ezekiel Emanuel. Dr. Emanuel, good to see you. Thanks so much for joining us.
Nice to be here.
So you were one of the architects of Obamacare. Is the president's public option plan really that similar to President Bush's?
Well, it is similar in that there are going to be some areas in the country where it's hard to get insurance companies and enough of them to compete. But the real issue here is the fact that we're going to have nearly 14 million people sign up in this open enrollment period. We still have about 10.5 million people who are eligible but haven't signed up, and we have to get to them. 20% of them don't even know that they have to get insurance or understand the exchange, and so that's a big number, 2 million people that could easily be drawn in with subsidies. And I think we need a big push to get them in. Despite all the advertising, a lot of people still don't know that they can get subsidies, they can get help with their insurance.
Well, getting more people insured is certainly one of the positives of this story, but largely this story has been a negative. I mean, we speak with business managers all the time, small business in particular. They're getting strangled by the cost of Obamacare. Individuals are just going bankrupt because it's costing them so much. I mean, is it fair to say the Affordable Care Act at this point is a failure?
Absolutely, totally not. That is a mistake. Go back to 2009, before the Affordable Care Act was passed. 50 million Americans uninsured. 20 million of them now have insurance because of the Affordable Care Act. The Affordable Care Act has helped bring down health care costs on a per capita basis to lower than it's ever been. Negative growth on a per-person basis in Medicaid and Medicare, and lower commercial rates than we had during the Bush administration, both on getting more people enrolled and on getting costs under control. It's been a success, and it's come in way under budget.
Right.
It's estimated that it's $400 billion under budget by 2019. So it is not a matter of a failure. It's actually a success. As President Obama clearly said, look, after 6 years, we've seen some unintended consequences. We've seen some problems with the legislation. No one from day one said it was perfect. And what we actually need to do is to make tweaks. It's interesting, conservative and Republican health policy people, when they're not in front of the TV cameras, agree on about 70 or 80% of the solutions.
Yeah.
If we just had some bipartisan collaboration, we could actually solve most of this problem.
Well, it's interesting. You say conservatives and Republicans, Zeke, but
no, conservatives and
let's talk about what one leading Democrat said just recently. You gotta. I'd love to hear your answer to this. Listen to this. Watch.
So you've got this crazy system where all of a sudden 25 million more people have health care, and then the people are out there busting it, sometimes 60 hours a week, wind up with their premiums doubled and their coverage cut in half. It's the craziest thing in the world.
Well, I think, yes, Bill Clinton is one of the sharpest people on policy, including health care policy.
So you agree with what he said, then?
Wait a second.
Okay.
I think if you listen to the full thing that he said, I think he has a point, which is that for Americans between 250% of the poverty line and 400% of the poverty line, roughly $50,000 to $100,000, we need to bolster the subsidies in the individual market. But I would also emphasize, for most of those people, they get their insurance through their employer. And employers have actually seen a slowdown in health care costs compared to what the health care costs under George Bush. And that has been a good thing. Unfortunately, what a lot of employers have done has transferred more of the costs of health care onto their employees.
Right.
And that is why employees are feeling bad. Not because health care costs are going up so fast, but because employers have said, you know, we're going to make our employees pay more. They keep making huge profits and transfer more of the cost of life onto their employees.
But when
That's
you look
the
at small business is saying, you know what? I'm not going to hire anybody more than 49 employees. I can't afford it because I'm going to be forced to offer health care. So
Maria,
from an economic standpoint, seriously, from an economic standpoint, this is one of the issues that managers cite as the reason that we're seeing economic growth of 1.2%, sir.
Maria, that is a canard. A lot of studies have shown that it's not health care costs that determine how many employees you hire. And look, I agree. The fact of the matter is we cannot be too vigilant on health care costs. We constantly have to do things to bring them down. And the fact is, Obamacare has actually allowed Medicare to do a lot of innovative things to keep health care costs under control. Introducing new payment models to move away from fee-for-service. That is going to be the key method for keeping health care costs under control.